A warm welcome to you all, and it's great to have you here. My name is Jamie McGeechan. I'm the events coordinator here at VOYCE, and a warm welcome to this community education presentation today on end of life care with death doulas. Our presenter for this afternoon is Dr. Maurya Cockrell. Thank you to our sponsors for VOYCE's education series. We are very grateful for their support. Upcoming community education webinars, Tuesday, May 10th, 10 early signs and symptoms of Alzheimer's. On Tuesday, June 14th, we have a presentation from Paracode, Making Independence Accessible. We have our conference, our annual long-term care conference returns on June the 15th, 2022, Maryland Heights Community Centre. The theme and title for conference is Care, who we are, what we do, where we go from here. Our keynote speaker is Dr. John Morley. We are delighted that Dr. Maurya Cockrell, who is presenting for us this afternoon, will be presenting at the conference. For more information and to register for the conference, please visit voicestl.org. That's voicestl.org. You can register today on our website. CEUs will be available for registrants and lunch also. And now to our speaker, Dr. Maurya Cockrell. Dr. Cockrell is an international author, international speaker and practitioner from St. Louis, Missouri. Her journey as a grief walker began early on as she coped with the loss of her grandparents. Dr. Cockrell uses her experience with grief and spiritual care to help individuals, families, communities and workplaces with end-of-life acceptance. Her recently released chapter, Becoming the Grief Walker, was part of an international best-selling anthology. You can hear Dr. Cockrell featured on the Wellness Enclave podcast and SoundCloud. We're very fortunate to have Dr. Cockrell with us this afternoon.
Well, thank you so much for having me. Well, thank you all for joining us this afternoon and learning more about end of life with death doulas. So I'm going to give you an overview about what the death doula profession is, what it looks like, the services that are provided, but also we'll get into some exercises. So I know that I'm the only one on camera for the webinar, but I hope that you're able to share your thoughts and comments in the chat section. So just an overview again for today, we're going to look at what is really a doula, how can a doula be used with death and grief, but also kind of what are the types of doulas out there and the services provided when it comes to end-of-life care. We'll go over the relationship between death doulas and the rest of the care team, and then explore where you can find one and get into some exercises for your own reflection. So when hearing the term doula, everyone I encounter first says, oh, okay, well, I'm familiar with a birth doula. So that was the original meaning, like a woman who serves. So most commonly, we hear about doulas in the birth setting, helping with the physical, emotion, and educational support for women as they go through that period. But in general, a doula is really a trained professional that provides the physical, emotional, and informational support. So starting with the stages of life, and we'll touch on the different types of doulas, but why is it needed? We discussed birth and death, but there are so many different stages of life brought to us in looking at, pre-birth and what that means. And as we journey through life, we have these encounters, these moments, and sometimes we have loss experienced through those ages. As Janie mentioned in my introduction, my first introduction to grief and loss was losing my grandparents early on. So experiencing loss at childhood should be acknowledged, but it might look different and feel different than when you're into adulthood. Also, when working with death doulas, you might see an elder doula at early stages as someone is going from adulthood to maybe late adulthood, but also a death doula can work with individuals of all ages. I know, unfortunately, here in the US, we have a lot of mass shootings and casualties. And so someone might lose their life earlier in their years instead of late in life. So really, this profession can touch on all age groups and generations. So as we just keep these kind of stages of life in mind, as we go through what it's like to cope with grief and loss throughout our lifespan. So you hear many terms, and even in the introduction, you heard the term death doula or elder doula, but also, like, I personally identify as a grief walker. So surprisingly, this movement began in the early 2000s. I know it's very popular now. I've seen a lot of articles when it comes to the pandemic response because we saw so many losses of life, dealing with grief on a collective level, that kind of sparked the interest for people to learn more about who we are and what we do. But like I mentioned, the movement began in the early 2000s, and just providing that support, again, the educational, informational, and emotional support. You might hear some other names like an end of life specialist, a Thana doula, a soul midwife, a death buddy, coach, or transition guide. So there are so many different types of names out there, but we all provide generally the same service with the same focus. So looking at a death doula and an elder doula is looking at that non-medical support. That is the strongest emphasis. It's not to be confused with a counselor or nurse, and we'll get into those later as a death doula is part of the care team, but just knowing that it's providing that soul care, like an add-on benefit to those that you work with. And so again, a death doula might be introduced when someone is diagnosed with a terminal illness, but also a death doula can help someone with an earlier stage, even with adolescence or teenage years. It's for those who kind of want to be intentional. We're trying to move towards this death positive society, being open and talking about grief and loss and not waiting until it's too late. So it is okay if you are, say, in your younger years, wanting to talk about end of life. And again, an elder doula is someone that can help those who are aging and then process end of life as it gets naturally closer to that time. So death doulas can work with individuals for years before their death. Again, it does not have to be exact at the moment where you're diagnosed with a terminal illness, but they can kind of be there providing guidance to you, your family members, or maybe patients or clients that you work with, and kind of just being that long-term support. And again, definitely share in the chat, if you've have experience with a death doula, maybe you are one joining us today, or if you're learning about it for the first time, we would love to know that. So looking at the stages of grief and just wanting to review the stages. And again, grief does not go in this exact order. You can revisit steps and stages. You might stay on them for a while. But just a reminder, the first one is kind of that shock and denial. This is soon after a loss. You might feel like, how do you carry on? You're kind of just in that initial emotional state and processing, like, what is happening? What is the news that I just received? What is going on? Next, after you kind of realize that a loss has occurred, you might enter that pain and guilt, trying to cope with the loss, figure out what happened, starting to figure out how in the world am I going to accept these feelings, and sometimes dealing with the physical pain. And I think that's important to note that a lot of this is around emotions, but sometimes our grief can manifest into physical form. So definitely wanting to be mindful of that as well. And thank you for sharing in the chat. I will also get into how you can kind of enter the profession, the education a little later, but thank you for sharing and happy that you're enjoying the webinar. So then you can get into kind of that anger and bargaining, and a lot of people can kind of stay on this stage depending on their own faith beliefs, but trying to say, how is this fair? How am I going to cope with this loss? Why didn't they take me? You might hear a lot of the anger and bargaining for someone that maybe lost a child or lost someone in those earlier life stages where it didn't seem like it was their time to go. So keep that in mind. And then the depression. I know I've been through all these stages, and especially depression, the sadness, thinking about grief, coming over the ways of how you're going to carry on. What does this mean? just having those emotions that can be scary and lead to anxiety. And all these are kind of normal reactions. And it's good to be familiar with these stages as someone who maybe wants to be a death doula or someone that's going through the current emotions to let you know that it is normal. It's okay to revisit. But also, as a death doula, you want to be familiar to know when you might need to triage to someone else. Like if someone is having those deep emotions around depression and showing signs, you might need to triage to a counselor or another mental health professional. But then we get into the next stage, which is reconstruction. So looking at how is life changing now that that individual is gone, seeing what that might look like. And then the last is acceptance and hope, knowing that depending on your belief, maybe it was meant to happen, seeing what lessons you can learn from it, how you can grow from it, not necessarily, again, trying to get over grief. That's why I personally prefer the term grief walker, because you're walking through these stages and it's nothing to get over, it's something to kind of confront and to work through. So looking at the different types of grief, this is also great to know for your own reflection, but for those, again, wanting to enter the profession to see, what type of grief is your client dealing with, and how can you help them? So there's the standard grief. There's a loss of sense of sadness. You might see it physically, mentally, emotionally. There's also the anticipatory grief, and that's most commonly what we see when someone is maybe working with us, planning for their time of transition, whether they just got a diagnosis, working with someone right now that just has fear around a certain age. So just making preparations and anticipating when that time might come. But for those family members, death doulas can also work with family of loved ones who are ill or family members, those who have transitioned already. But in terms of anticipatory grief, if you're thinking about the loss of a future parent or significant other, you're kind of making the preparations for that in the future. But there are so many other different types when it comes to chronic and complicated, cumulative. Another one is just looking at exaggerated grief or secondary loss. Because you lost this individual now, who knows, depending on your situation, you might have loss of income, loss of housing. So definitely different types to go through. And I'm sure there are more than what's listed on this page, but some that I particularly focus on is also collective grief. And this was extremely a popular topic during the pandemic, which we're still dealing with. But how are we collectively grieving for those we have lost due to COVID or other illnesses, and kind of looking at what loss looks like on a community and global level? And so I think I might have seen a question in the chat. Distorted grief can be more that leads to self-destructive behavior, and that's one that you would definitely want to involve a mental health therapist, but it could be grief that now the anger is lashing out, and there are definitely just some physical behaviors that are associated with that type of grief. And I know we might have more questions, and what I'm not able to answer right now, we will at the end of the presentation. Also thinking in mind of diversity, and especially religious diversity, I wanted to just incorporate a slide that lets you know that death doulas are found in all traditions of faith, and just some examples of being mindful of the relationship between the body and the person when it comes to working with those of different faith traditions. For example, Christianity is more of a separation of the spirit from the body, but some other traditions like Buddhism believes in reincarnation. So it's important, again, whether you are a death doula or just helping someone in a long-term care setting deal with grief, being respectful and mindful that they might have traditions that are different than your own. So next, looking at the services that a death doula can provide. And looking at the first one is care coordination. And with care coordination, you're mainly helping with appointments or reminders, helping research insurance providers. And this service is commonly seen also with the Elder Doulas specialty. So it's helping your client connect to the resources that are needed. There's also closure work. So having those difficult conversations around last wishes or advanced care, really guiding clients to assist with letters of forgiveness. I know I've worked with individuals who do legacy letters, thanking individuals for the impact that they had on their life to share now or maybe after the transition. There's also deep listening and holding the space. One thing about entering this profession is to remain unbiased and to listen without judgment. So definitely there can be moments of silence and you have to be comfortable just holding the space, being there for that person and potentially that physical or through virtual assistance support. There's guided meditation. I've worked with some death doulas that focus on incorporating yoga or breath work. So I see a lot of people entering this profession maybe from being a massage therapist or, a yoga instructor. And there are different ways to kind of incorporate this work into your own practice. Legacy work. This is one of my favorite areas. It's doing life reviews with clients, helping them just articulate what their legacy is and the impact. And we will have a chance to kind of explore our own legacy a little bit later. But also this could be creating gifts, working with individuals that, maybe want to create a photo book or a photo cube of their loved one. So it's helping, getting the supplies, doing arts and crafts, and that can all be part of legacy work. Meaning making, and this is where you can kind of pull on the spirituality aspects of it, but just helping those who are processing their upcoming departure, assess their life events and lesson learned, kind of making meaning of the life that they've lived, especially if they're closer to that point of transition. You can also assist with planning. So that could be the living wills or DNRs or 5 wishes document, which we'll get into in a few slides, but you can also help with planning a funeral or a burial or memorial. So I've seen individuals that are more administrative, love organizing, and they do well with helping individuals plan. I know for me, in the St. Louis area, I tried to partner with law firms and estate planners to help with the legal logistics when it comes to your will and trust and things like that, because you can kind of pick an area of expertise and specialization as a death doula, or you can keep it very broad. Others help with respite care, so helping with the dishes or groceries or errand running. And I've seen a lot of new companies focus on providing that care and support for family members, assisting with those tasks. But if that's something that you like to do, definitely pull on just services you like to provide or ways that you've helped others in the past. And for those interested in entering the field, those are ways that you can incorporate those services now to a specialized audience that are looking for death doula services. But also vigil sitting. And that can be sitting bedside, sitting with someone in their last moments of transition, also supporting the family in those final hours, but creating that safe and calm place that's ready for a transition. Some death doulas are very creative and love, altering the space in the home if you have in-home hospice or things like that, just to sit and create that calming environment for the loved one. So looking again at the role on the care team, and this is a topic that I've seen from incoming students or people that I work with, just saying, how can we work together? And especially for today's topic, how can we really incorporate death doulas into the care team for our clients, patients, and residents? So just to go over some of the common questions that I get. So typically death doula services are not covered by insurance if you're thinking of like Medicaid, long-term supports and services, or Medicare. I do know that there's insurance on the death doulas and there's a different specialty for doula coverage if you're working with clients, say that you're assisting with errands or groceries or any transportation, things of that nature. You would definitely want to consider insurance, but on the Medicare and Medicaid end, those services are not yet covered. But still think of the death doula in the same way as the birth doula. The birth doulas are still getting kind of that recognition, having that overarching body to certify them and to review the standards. So I think as both professions keep moving, this could be something that could be an extra benefit in the future. But I know different countries view their death doulas differently. I've worked with some individuals in South Africa. In the heat of the pandemic, they were given COVID supplies, able to enter their clients' homes and treated just like a regular member of the care team. So definitely depends on, what area of the world you're in as well. But looking again, it's non-medical support that's important to just keep in mind, but it's a way that we can all kind of work together to provide the best service to our clients when it comes to end of life. So just thinking of some of the care members and teams that you might see out in the long-term care end of life field, hospice, death doulas work well with hospice agencies. I will say very advanced hospice agencies have death doula services. So you might see a lot of the legacy work or doing crafts like tiles or even incorporating music in end of life and memory. So some hospice organizations are advanced and maybe they might work with death doulas on, volunteer basis. I also know that a lot of times students entering this profession might go to hospice trainings and see, what kind of skills are they teaching the hospice volunteers, because a lot of it can translate over to you if you're volunteering your own or getting into your own practice. I will say I have worked with several hospice directors that are now requiring those who attend the training to volunteer for a certain period of time. So definitely make sure you know the training requirements if you're looking to kind of enter this field on your own and not work directly with a hospice organization first. But for those hospice organizations that maybe don't have the staffing, death doulas can come in and provide that extra support, whether it's sitting bedside. A lot of hospice team members have caseloads and insurance requirements, but death doulas are not really restricted when it comes to time and capacity and helping reinforce some of the end of life education. Also with palliative care, and again, palliative care is more just looking at comfort and support, not hospice, but still can be there if you have that anticipatory grief in the future, or maybe you have a new diagnosis and you're just being proactive and thinking ahead. And that way you can still kind of address these terms in long-term planning while the individual is in palliative care. Also, spiritual care. I know Jamie mentioned my background. I did spend some time working in spiritual care for a local hospital, so working with the hospital chaplains. A lot of the work that I did was looking at end-of-life metrics, how long chaplains were spending per death in different types of units, and also the community support. So some death doulas might work as spiritual care generalists. That is a type of training. If you're interested in more of the spirituality side with end of life, you can kind of look at helping those more with meaning making, and then understanding as a death doula when your client might be in spiritual distress. And then you can kind of partner with the hospital chaplain or a clergy member, depending if you're working with someone in a long-term care facility. I know they have visiting ministers and things like that, or a spiritual care advisor. So it's always good to kind of understand the scope of practice for a death doula and the ways that they can work with other individuals. So thinking about, where can you find a death doula? And so many death doulas have their own practice or serve as a collective. I know there is a Midwest End of Life collective. I know that I work with 2 death doulas here in the area, but a lot of individuals have their own practice, kind of working as a coach or consultant umbrella. Some, also work with partnering organizations. I know there are some organizations looking to place death doulas with clients. So that is an area. You might also find death doulas working in adult daycare settings, coming in and doing legacy workshops to facilities, to the participants. That's another area. Death doulas might be in funeral homes and sometimes working with the team to help family members pick out the clothing for the deceased or work on the obituary if they don't have anyone skilled to do that in their own family. I know this is something for death doulas that are more creative and artsy. You might have a background in Canva and marketing, and you can use those skills to help someone, create a memorial PowerPoint slide, a legacy video, or like I said, even help with an obituary. But also I'm seeing more death doulas now working in healthcare offices, especially the transition between elder doula services and death doula. But a lot of boomer patients are aging. And so I've seen some hospitals and healthcare offices partnering with the death doula to kind of have those conversations, the follow-up. I think it's a great partnership. Again, like I said, some care members are restricted by insurance limitations or time restrictions. And so they can kind of partner with a death doula to reinforce maybe having their advance directive, looking at a DNR and having those conversations that they might not have the time for with a normal patient visit. So I do want to spend the second half of our webinar going through some of the activities, and I still will touch at the end more about the education and experience behind getting into the field. But I wanted you to have an overview of kind of what a death doula is, the practice, the relationship, but then give you insight into what the work might look like. And in particular, like I said, I love to focus on legacy with some logistics and planning. But the first topic for today is I want you to kind of reflect on your own legacy. And again, I know we're using the chat and Q&A function, but I will give some responses and prompts, so feel free to share in the chat. So thinking of legacy in mind, I have this value slide that I want us to just take a few moments to look over. And if please let me know if you don't have any scratch paper, you can kind of use the chat to hold your notes, but think of maybe 3 to 5 values that are really, sticking out to you on the screen, some that truly resonate with where you are right now or some thoughts you have about this subject. And as you feel comfortable, share them in the chat. One thing that's a beautiful exercise like this, I do with all ages, and just seeing the values of those around you can just help set the tone for the conversation, the intention, and help you get started when it comes to figuring out your own legacy. But just to break the ice, looking at the value screen, I know that creativity is important to me. So sometimes as I do sessions with clients, we're using color pencils and markers to work through these conversations, but having a creative outlet is definitely important to my own emotional well-being. Looking at the screen, I would also say that legacy, it's definitely a given of why I'm into this field, but I just believe that we each have a purpose, and finding that purpose, having a lasting impact on our family, our community, that's important, and trying to be mindful of the legacy that I'm living behind. And I see someone share community, compassion, self-expression, and well-being. Definitely the community, us coming together to learn about this, and I'm sure that translates to volunteering and serving. I see someone else shared a legacy book, humility, friendship, humor. I love that. And like I said, working with, young adults, they see the value slide and they mention things like friends or achievement. And I think it's great when you can kind of find that bond with others. And this is a way to help you just think about your core values. And again, keep sharing them in the chat. I love to see it, like gratitude, travel, love, authenticity, harmony. And so when thinking about our legacy, and as you keep sharing, in the chat, how is the way you're living right now, is that aligning with the words that you're writing? I know I had to make a hard decision. Like I said, I value creativity, and I felt like I was taking on too much that was limiting my creative space. So I want people to remember me as being creative or organic. So that's something that I kind of did a self check-in. I know different people have affirmations or goals that they review every morning, but reflect on the words that you mentioned, and see if you ask your best friend or a community member, or maybe even a coworker, would they list the same values for you? And if they show you something different, then, just take that information, see if there's anything you want to incorporate into your own values list, or maybe it'll give you some insight on some areas that you want to highlight more. So when you do transition from this earth, people will remember you the way that you had hoped. And thank you. Keep sharing that. And again, you don't have to put your thoughts for the reflection questions, but hopefully you are just journaling as we go through. Next is looking at remembering. And so remembering is, and this is a question that I just want you to take a few moments and reflect over and think about different traditions that you have in your family. For me, remembering is having a piece of jewelry of my grandmother and remembering the times that she wore it. Remembering could be looking over old photos of loved ones. It can be for some, and think about the different populations. I work with all backgrounds, like I said, religious traditions, but also different races and ethnicities. And some have the tradition of creating memorial shirts. And there's nothing wrong with that. And remembering for them is having that physical reminder, a shirt, a mug, or something with that loved one. And thank you for sharing. Remembering is baking coffee cake from family members. As my grandmother made them every Christmas. You think of coffee cake, and I remember my grandmother making lemon meringue pie. And that is what, remember, I cannot make it myself, but it's something that I enjoy and I think about. But just like it was shared in the chat, whatever you feel comfortable with, what is remembering for you? Is it when you listen to someone's, favorite song or put on a shirt? Just definitely share. But also think about being remembered. So what is it like for someone to remember who you are? And for me, I might say being remembered is having my loved ones read my writing. One reason why I write and I participate is because I want those that come later to, get to know me a little bit better by what I was thinking, what I was writing, what I was feeling. So that's being remembered as for me. It could be other things like pictures or songs. I see signings, smells, and phrases. Being remembered could be, having a certain gift or donation to an organization. Thinking of legacy, like I said, working with clients and legacy gifts, they might want to donate to a nonprofit, and that could be their way of being remembered. But definitely share, as you reflect over your own upcoming, transition, whenever that might be, how would you want your loved ones to remember you? I know for some, it kind of also relates to their burial, just beliefs in what they want. They might want their ashes to be in a special, vase or things like that. And being remembered as having that physical presence still there. So it can be so many things for individuals. The next question that I often use in my death doula sessions is discussing sliding door events. And I just love it because I think it's important to document for your own life and for those around you, cases and situations in your life that happened or didn't happen that, changed and shaped who you are today. It could happen in your grandparents' lifetime, or I know thinking back, a sliding door event was when my father moved from Birmingham to East St. Louis. I mean, just his move shaped my upbringing and who I am. But think about, that job that you didn't take and the impact that it had on your life. And these are types of stories that I ask my clients to document. I mean, it's great to have that obituary at end of life, and it is great to kind of have the mementos, but to know more about your loved ones and reading a journal, reading a letter. I think those are beautiful gifts that you can kind of leave behind. But also as we go through, prompts such as sliding door events, it helps us practice gratitude. I think one way as a community we can get over the mortality and the morbidity about just feeling and discussing grief and end of life is to normalize it, to know we're going to have these feelings, to know that we should kind of capture the legacy, the moments, and the thoughts. So definitely think about your own sliding door events and write them down and the impact and meaning, and figure out if you want to share that with loved ones around you now, or, keep it in a safe place to share in the future. In the chat, do you have any sliding door events, or maybe it was a move, it was a marriage that kind of shaped the person you are today that you feel comfortable sharing? And, it's all part of your story. And that's what I enjoy about legacy work, is helping people reflect on their story and who they are. I think we can get so busy working and doing and not as much just being. So when you enter the field and you work in the area of legacy, you kind of help others slow down and pause enough to think about what shaped them, what matters, and how to spend their remaining years a little more intentional. So next, looking at logistics. And in some workshops, and I see in the chat, concern sharing the death has changed, newspapers and Facebook. I'm so happy you mentioned Facebook and social media, because one thing that can be considered a nice feature, I've noticed Facebook has an option that if you do pass away, you can kind of transition your page and make someone else the admin. So someone wants to, look at who's posting or share information about you. Because we're in such a digital age, it's something to think about what will happen to your social media accounts, how you want that news shared. I do know Facebook can also be extremely triggering. Some people posting images of people passing away, or, just negative thoughts around grief and end of life. So there is a time and a place. I also know personally, I've worked with a funeral home that streams the funerals on Facebook for family members that might be out of town. And that was very popular during COVID. So definitely there is a place when it comes to social media and end of life. But thinking about logistics, and it's a topic that I cover with some of my clients, but some people will just focus on logistics. Loss is difficult. And so while your loved ones are grieving, you don't want them to stress over your personal affairs. And that is why it's so important to kind of think about your documents, your wishes. Are they written down? Are they shared? If you have property, how are you handling all these logistics and having this information in an accessible place for when it comes to be that time? So looking at some of the important documents, your last will and testament, your living will, advanced care directive. So your last will, thinking about how you would like your property to be distributed. If you have advanced care directive, thinking about your desires for medical treatment. If you're unable to speak for yourself, what are your wishes? Some individuals might have a power of attorney, and that's a legal document. It shows who will act on your behalf, make those decisions about money or property, say you become incapacitated. But also thinking about DNR, so do not resuscitate. So knowing if you stop breathing, if you want your providers to perform CPR or not. And I know these are some questions that we might not like to think about or plan for when that time comes. But again, think of it as a loving gift for those around you, that you're taking care of these documents and having these conversations early on. So when it does come time to grieve, and reviewed all those stages our loved ones will go through, they can just go through those emotions and don't have to have the stress of the logistics behind it. 5 wishes is also a popular document. So it's thinking about, the person I want to make healthcare decisions for me when I can't make them is, and writing that down, your wish for medical treatment that you do and you do not want. If, an unfortunate situation you're in, a coma, maybe the time frame you would want to be kept alive on breathing or ventilation. Think about things like that, how comfortable you would want to be. And that's why it's good to be mindful of the different cultural traditions. Some believe that you should use pain medicine and comfort care. Some faith traditions believe that, there's certain purpose in pain and suffering. So it's good to kind of reflect over your own values And it's okay that your wishes might differ than those around you. And it's important as you document this to share it with someone that you trust that will live out your wishes. And as we serve as a death doula and as we serve the loved ones that are now having these conversations with us, I mean, just think about respecting their wishes at end of life, making this a peaceful transition for them. And then we will deal with our own feelings of grief and loss. But also thinking about how you want people to treat you and the things that you want your loved ones to know. You know, there might be certain letters that you leave your loved ones for a holiday or a birthday. One of my favorite movies is P.S. I Love You, and he sent letters to be mailed after his transition. So just think about the things you might not feel comfortable sharing now, but maybe you will one day and in a written format. Also think about all the important financial information when it comes to your bank account. Now, again, keep all this in a secure area. And there's a great book that I recommend that you can just go to a local bookstore, and it has all the things that you need to write down when it comes to like your bank account numbers and things like that, but keep it in a secure area. And in that book, it says to share it with maybe 3 or 5 trusted sources. And for you, it might just be 2. But because you're documenting all these personal details about your life, it's important to know that you keep it safe, but also that you're kind of leaving this to someone that you trust to handle your affairs. And that way, when you do transition, your family members aren't scrambling to find your bank statements or figuring out what to close. So have your number, you know, if you have online access, what credit cards you have, you know, investments that people might need to check on, the investment number, accounts. It's important to know what you still owe. Is there a mortgage for, you know, student loans, medical bills, but also is there anything owed to you that people should be mindful of? And it's just anything, maybe you have a lottery ticket that you've been saving onto, whatever is important to you and what you consider that financial information, just write it down, keep it secure. And for some individuals, you might have to update this a little more frequently. Like I mentioned in social media, you can kind of share your page with someone to become the admin. So maybe you're writing down your Twitter login or your Instagram handle to make sure that your friends can kind of take care of that for you. And I think it's important to kind of normalize that. I've used a feature on Facebook. So if something happens to me, my friend can take over my page. And that's something that I'm glad we're starting to discuss. But all these should be normal conversations that we have early on. And then also thinking about your important contacts. And this is not, you know, a full list of all the names and numbers you might need, but have that close friend. I remember losing my uncle, and he actually had a favorite pastor that he wanted to deliver his eulogy. So it's knowing those things to help honor your loved one's wishes. And for you, if you have this written down, it's a lot of less guesswork and headache. And again, you just want to make things easier on your family members and loved ones. Again, you can look at some of your final wishes, and hopefully as we go through these slides, you're kind of just making note of the topics you need to cover or the things you've already discussed with your loved ones, but also getting down to the final wishes. What is it that you want? The type of burial or cremation, what clothing or jewelry, you know, the speakers, the music selection. I know very many people that have their song choice and poems that they want read at their homegoing, or just, you know, might have want a water burial. Or for me, I know there is a service that you can turn some of your ashes into jewelry, and that's a personal choice of mine. But there's so many different options out there. So don't be afraid to explore and to document what you want. Some people don't want a funeral, they want a party. And I think we should, you know, accept people for their wishes that they want, throw that party, think about it as a celebration of life. And I think it's a way for us to just start viewing, again, death as a positive thing, normalizing that we all go through these phases. It's something that we will all encounter, but figuring out how to make it easier for us that are going through it, but also those that we leave behind. So just going through some practices that anyone in this room can kind of incorporate into their daily work. those, again, that are interested in entering the field, or those that might work with patients and residents that are kind of going through this process. But thinking about, allowing extra time if you're working with older individuals, sitting face to face if in person, if you're doing virtual doula support, having your camera on, having those nonverbal cues, kind of sticking to one topic at a time. There's so much to cover, especially when it comes to the planning aspect. So it could be done in multiple sessions. I know people might start with, okay, let's collect all your financial information, or you could spend kind of a day or session exploring the burial recommendations and options. So just not rushing the conversation, taking your time, sticking to one topic. It helps to use that written communication. That's why I think it's great for you to kind of document your thoughts, your feelings, your wishes, but also as a death doula follow up, kind of recap the conversation and help your clients kind of document what their wishes are. And always respect the cultural diversity, being open to what death might look like for other traditions, what grief might look like. And then if you are kind of entering this field, being comfortable, learning more. I mean, I have to continually educate myself on different transitions and backgrounds and cultures. And I think that's something that we can all do. Also, just looking at some insight onto the conversation structure and just thinking about before you work with someone that is going through the transition, making sure that you feel comfortable with your own mortality. And that's one thing I say to all the death doula students that I've worked with is go through these exercises yourself, answer these questions. You really need to know what it feels like to kind of sit in their shoes and know how it might feel, and honestly have those conversations with your loved ones. I mean, it's great practice, but it also helps you kind of know your limits, what areas you might want to focus on, what topics you feel comfortable talking about. And like I said, maybe when to pull in a death doula partner, or maybe work with, a provider, a clergy member, and things like that. So using your active listening, but knowing to set up the conversation, introduce the purpose. A lot of times individuals are nervous talking about this topic. If a child brings it up to their parent, they might be thinking, is there something wrong with me? Are you hoping that it's almost my time? But saying, no, it's just important that we have this conversation now. So whenever that time might come, we'll be prepared, and we can just focus on spending time together and doing all the things that you love, and not going through the headache and hassle of all the paperwork. Check for boundaries. You can't force someone to have these conversations. We can do so much providing people with the tools, the resources, the information, but checking to see, what they feel comfortable with. So is this okay to discuss end of life, or do you want someone with you? Assessing the understanding and values. That's why it's great to know someone's values, your own values, and how that aligns when you're entering this work. Allow for storytelling, especially if you're doing legacy work, and just know that there's a purpose, and it could be maybe a situation that someone is still dealing with and processing. And as a death doula, you can see if someone's maybe fixated on a past trauma or something like that. It might be good to work with a psychologist or refer them to someone else, but allow for them to just tell you who they are, and just have that time for free-flowing conversation. Also explore the topic of the support system. This is extremely important, and especially looking at long-term care setting, who is the individual that's visiting versus who is the one that has the financial obligations to provide the care. Knowing who those key players are, who should be involved with the decision-making, understanding what's important for your client. And then when it comes to closing the conversation, summarizing, doing the teach back, but also following up to make sure you address all the topics of conversation, what resources to send, and again, what are the next steps. And always document, and like we just discussed, make sure that you help your client document their wishes and wants. So I do want to address, how to kind of enter the field. You can definitely, earn a degree. Most commonly I see in social work or theology. There's also individuals that focus on thanatology. So that's kind of the study of death and dying. but there are so many degree opportunities out there. You do not need a bachelor's or an associate. I see a lot of people entering from those professions, but no, a degree is not required. Volunteer, I think I saw a few people said that they were trained through the NODA, just different programs, a No One Dies Alone program. That is a great volunteer opportunity that a lot of hospitals had before COVID. I would have to check and see if they're still accepting volunteers now, but those are for the patients that don't have family members or loved ones around, being with patients at their moment of transition. So you could be sitting, for some time, but holding that person's hand as they take their last breath. And some people are called to do that kind of work and sit there and be with that person. Hospice, volunteer for nursing homes. I know I used to volunteer as an ombudsman for VOYCE. And so just, seeing people that were getting closer to that stage, a lot of times they were telling me stories of their life and wishes and regrets and things like that. So kind of getting comfortable being around those that are in that time of transition. There are many certificate programs. I've seen people share in the chat where they went to school for their end of life doula training. And some people just kind of jump right in. Maybe they've had enough experience with death and loss throughout their family that now they're kind of trying the death doula roll out in a volunteer basis and working with the individuals. And maybe they're doing trainings like this one on what a death doula is. But there's so many different areas to get involved, so many different routes to take. You can volunteer with hospice. You can just learn to make better decisions for yourself. But it's something to think about. And let me know if I did not answer your question about school. I know I got my minor in theology, but I worked in spiritual care. I do have training. I am a spiritual care journalist. I've been trained as an end-of-life educator, but also as a death doula. But there are so many different opportunities out there. So continue to kind of share in the chat what programs you've seen, you've experienced. But that is just a little bit more of how to get more involved if you want to be on the side of providing that support. So just remember that, grief is an ever fluctuating process. And it's important to know that death doulas are around to kind of help you, help your loved ones, maybe help those you work with deal with end of life planning and grief support. Death doula support can come in terms of planning, like I said, living wills and advance directives, or it can be as creative as designing a living funeral. It really just depends on what your need is as a person kind of going through this process. And for those who want to enter the profession, just think about the skills that you use, your gift for maybe music and art, and how you can help those that are now at that end of life stage. So I will go ahead and pass it back to Jamie and see if there are any questions.
Thank you so very much for an excellent presentation, Dr. Cockrell. It has been wonderful. Thank you so much for your time.
Thank you so much for having me. I hope you all enjoyed learning more about the profession, but also trying some of the exercises and reflecting over your own legacy.
Absolutely. Thank you. We do have some time for a few last questions. If anyone would like to ask Dr. Cockrell any last questions, please do submit your questions into the chat window now.
And thank you for those that have shared comments. I've seen some wishing you knew about having death doulas, and it's something that we can continue to just educate the community on. And I'm thankful for VOYCE for, having this presentation. But to know maybe you weren't able to experience working with one, but now you know and you're aware, and you can kind of share this resource with others and kind of help those transition and share your story to educate those around you.
Absolutely. It looks like we do have 2 questions, Dr. Cockrell.
Okay, I have been teaching death doula students since 2019, and that's when I too heard the phrase more. At that time, before then, I didn't consider myself a death doula. I didn't go by that term, but I worked with end of life and spirituality. But knowing that it was an actual term and phrase, I started teaching others in 2019. Do you generally charge by the hour or a flat fee? Now, getting into best practices for business, I tell my students with certain services, I would say, like a legacy project, you might have a flat fee for making a scrapbook or things like that, or knowing your time. Personally, I don't like charging by the hour when it comes to sitting vigil or visiting a loved one. I think it's important to consider retainers or package pricing, because you don't want anyone to feel like, oh, you're only visiting their loved one because you know you get paid 75 an hour, but also making sure you kind of over deliver what services that you're offering. So there are different payment models, but I usually consider hourly if you're working on planning documents, facilitating a family meeting. But when it comes to more of the visits or projects, thinking of flat fees or retainers. How is the job market for the deaf doula professionals? You know, I would compare it to the birth doula. There's still a lot of work in that area. I think in terms of making it your full-time career, I have seen that done. It's a mix of working with business to business. You know, if you're offering deaf doula support to an organization, so I've done some of that. You're looking at a contract to partner with an organization. They provide the client. You're kind of offering that support similar to a EAP, employee assistance program model. But also there are some new tech startups that are looking to pair deaf doulas with clients. So I do see that being on the rise, but also you can work as a deaf doula and find a job working as a bereavement specialist or a volunteer hospice coordinator at certain facilities. There are different ways to kind of enter the field and profession. If you do want to make this, you know, your full-time work, there are options. Hope I answer your question.
And I must say before we go, we are very fortunate, Dr. Cockrell, that you will be presenting at VOYCE's annual long-term care conference on Wednesday, June 15th at Maryland Heights Community Centre. And the topic of your presentation is the interplay between ageism as a social determinant of health and end-of-life care. I was wondering if you could share a little bit about that, please, Dr. Cockrell.
Yes, I'm very excited. If you attended my presentation last fall with VOYCE, we discussed kind of ageism and elder speak. And so looking again at how ageism truly affects someone's healthcare, but their financial outcomes, the community that they live in, and how all those social determinants of health can contribute to their end of life, you know, their wishes, their wants, their care. And a lot of times, especially in the US, we see them entering the long-term care environment. So kind of looking at an overview of how we can be more mindful about the different roles, our social community, our faith traditions, how we're looking at aging, and ultimately, you know, how that impacts the health outcomes that can contribute to their mortality. So a little bit combination of this presentation, you know, elder speak and ageism, but also looking at the social determinants as a whole.
Absolutely. And today's presentation will be recorded and the link will be sent to all of our attendees. I must say also there will be a survey which will display on screen at the end of today's presentation. Please do share your feedback for us, please. We're always very grateful for your feedback. I'm going to display now contact details for Dr. Cockrell if you would like to ask any more questions. It has been a wonderful, wonderful experience for us. Thank you so very much, Dr. Cockrell. It's been an absolute pleasure, and we're very grateful to you for your time, your knowledge, and your expertise. Thank you so very much. Thank you.
Thank you.
And thanks again to everyone for attending this Voice Education webinar this afternoon. It's been a pleasure. We hope you can join us at our VOYCE Annual Long-Term Care Conference on Wednesday, June 15th at Maryland Heights Community Centre. And registration is now open at voicestl.org. That's voicestl.org. Thanks again for joining us, and we look forward to seeing you again soon.